Hello everyone, today is day 22 of discussing important perio tables from Dental Pulse. Today we will discuss finger rest in periodontal instrumentation, also known as fulcrums. As described in Carranza and Wilkins, a proper finger rest is essential because it provides stability, control, precision, and most importantly, prevents trauma to the soft tissues during scaling and root planing. Finger rests are broadly classified into intraoral fulcrums and extraoral fulcrums. Let us go through each type one by one. First and foremost is the conventional finger rest, which is the most ideal and most commonly used fulcrum. Here the finger rest is established on the tooth surface immediately adjacent to the working area, preferably on the same tooth or adjacent tooth. This type provides maximum control and stability, and therefore whenever possible, this should be the finger rest of choice. Next is the cross arch finger rest. In this type, the finger rest is placed on the opposite side of the same dental arch, usually when an adjacent tooth is not available for support. Although it offers slightly less control than the conventional fulcrum, it is still considered an acceptable intraoral finger rest. The third type is the opposite arch finger rest. Here the fulcrum is established on the opposite arch. For example, a mandibular finger rest may be used while instrumenting the maxillary teeth. This type is only used when intra-arch finger rests are not feasible, as it provides less stability compared to conventional and cross-arch fulcrums. Now we come to modified intraoral fulcrum known as finger-on-finger fulcrum. In this technique, the fourth finger of the operating hand rests on the index finger of the non-operating hand. This fulcrum is especially useful while instrumenting the lingual surfaces of the maxillary posterior teeth, where direct tooth support is difficult to obtain. So it is very useful in restricted access areas. Now let us move on to the extraoral fulcrums. These fulcrums are used when intraoral fulcrums, the intraoral finger rest cannot be established, particularly while working on maxillary posterior teeth. So in the palm up extraoral fulcrum, the back of the finger rests against the right lateral aspect of patient's mandible or face. This technique is commonly used while instrumenting the maxillary right posterior teeth. Finally, we have the palm down extraoral fulcrum. In this technique, the front surfaces of the fingers rest on the left lateral aspect of the mandible. This fulcrum is commonly used while instrumenting the maxillary left posterior teeth. So, palm facing downward while instrumenting the maxillary left posterior teeth. So, to summarize, conventional finger rest is the ideal and the most stable. Cross arch and opposite arch are alternatives when adjacent support is not available. Finger on finger fulcrum helps in maxillary lingual posterior areas. Palm up and palm down are